everyone, today we're going to do a training on medical insurance claim, and hopefully by the end of this training you should be able to do one on your own. Here's a mind map of different type of insurance claim that we have. For example, Medicaid, Medicare, Medicare Advantage Plan, and other claims. How to process claim. Claim processes involve certain claims upon submission to collect and verify information about the patient and provider. These are the steps how to process a claim. The health insurance specialist complete paper CMS 1500. Then they batch claims and submit to the clearinghouse. The clearinghouse scan the paper CMS 1500 and convert them to electronic format. And finally, the clearinghouse verify claims data and transmit to the payers. What are some reasons for the claim to be denied? Well, we can have minor errors, wrong insurance company bill, non-covered charge, the referral, or the out of network. What are acceptance of assignment, out-of-pocket payment, EOB, and assignment of benefit? Well, acceptance of assignment is a provider has a payment in full whatever is paid on a claim by the payer. Out-of-pocket payment is a payment the patient needs to pay with his or her money before he or she get any service at the doctor's office. EOB is a report of the detail that result of processing the claim. Assignment of benefit is a provider receive reimbursement directly from the payer. What is a clearinghouse? A clearinghouse is a public or private entity that processes any non-standard data element. For example, paper claim into a standard data element that will be an electronic claim. Here is a picture of the life cycle of the insurance claim. First, it goes through the submission, then the processing, then the adjudication, and finally the payment. What is a EHNAC? In other words, Electronic Healthcare Network Accreditation is a volunteer self-governing standard development for organization in the United States established to develop standard criteria for organization that electronically exchange healthcare data. What is Medicaid? Medicaid are for individuals with income below the federal and is limited to individuals who qualify into three groups: categorically needing, medical needing, and special group. What is Medicare? Medicare is a government program for people over 65 and certain disability people under 65. Medicare is a two-part group. Part A is to reimburse providers for inpatient and some home health service, and Part B is to reimburse the outpatient and some of the office service. Let's continue with Medicare. Medicare has other four different parts. Part A is for Medicare hospital insurance, Part B, Medicare medical insurance, Part C, Medicare Advantage, and Part D, Medicare prescription drugs. Let's talk about TRICARE and Children's Health Insurance Plan. TRICARE is a healthcare program for active duty members of the military and their qualified family members. The Children's Health Insurance Plan is a medical coverage source for an individual under age 19 whose parents earn too much income to qualify for Medicaid, but not enough to pay for a private insurance. Now we're going to talk about SHAM VA and COBRA. SHAM VA is a health benefit program in which the VA shares the cost of certain healthcare service, and COBRA is a landmark federal law passed by Congress in 1986 that provides continued coverage of group health benefits to employees and their family upon a certain qualified events where such coverage would otherwise be terminated. What is electronic data interchange? EDI is the computer-to-computer transfer of data between providers and the third-party payers in a data format agreed upon by sending and receiving parties. Now let's talk about claims adjudication. After the claims have been validated by the payer's claim examiner, it undergoes the claim adjudication process in which the claim is compared to payer's edit and the patient health plan benefit to verify that the required information is available to process the claim. Claim is not a duplicate. Payer's rules and procedures have been followed. Procedure performed or service provided are covered benefits. What is a ERA? An ERA is an electronic version of a payment explanation which provides details about provider's claim payment, and if the claims are denied, it will then contain the required explanation. ERA are provided by plans to providers. What's the difference between deductible, copay, premium, and co-insurance? A deductible is an amount that needs to be paid before the insurance company pays a claim. A copay is an amount of payment which needs to be paid every time a patient is getting a medical service. Premium is an amount to be paid for the insurance policy. And finally, a co-insurance is a type of insurance that makes payments against a claim. What is reimbursement, capitation, and fee of service? A reimbursement is the money that you get back after you spend. A capitation is arrangement for a payment. A fee of service is a health insurance plan that allows the holder to make all decisions independently. Now let's talk about a process to appeal for a claim that has been denied or rejected. Well, you need to understand why your claim was denied. Also, eliminate easy promise first and submit the right paperwork. What is the difference between electronic and paper-based? Well, electronic based is faster to reimburse for their claims by reducing the time for process to be completed. Also, it reduces 2 weeks rather than paper-based that takes up to 5 to 7 weeks to receive it. Finally, there is no need to be printed. Every document has an electronic base rather than paper-based that you need to print and deliver. And now we are going to watch a short video of how to get a patient Superbill in Microsoft.
Good morning, everyone. As you know, we have to go to Medisoft. What we're doing right now, we're going to focus on how to do a Superbill. So the first thing we need to do, we need to come up to Activities, then scroll down to Appointment Book. And once we get into the Appointment Book, we can select any date. Let's try September the 16th, or let's go to the 17th. And I'm going to shoot for 8 o'clock. So double click on the 8 o'clock slot. Come down where it says Chart. You can select any name. I'm going to select Herbert Bell. I'm going to click Save. Okay. And then once you do that, I'm going to come up to Reports. Scroll all the way down to Superbills. Click that. And you see where that says OK? Hit OK. Hit Start. And remember, you must change the date for whichever date you selected for the appointment book for your patient. So my patient is Mr. Herbert Bell. So you're going to select him twice. And you're going to click OK. And then this is what the Superbill looks like. Now remember, the Superbill is used in the physician office. And of course, it has the basic data about your patient. On the left-hand side, it tells you all the exams, whether new patient or established patient. And also, you'll see like everything that the office offers. Like for instance, let's go down to injections. Okay, let's just say if Mr. Bell needs an influenza. This is the code 90724 is what we'll put on our Superbill for Mr. Bell. Also, let's just say if he had an HIV test, come over here, and this is the code 86311. So basically, the Superbill is nothing but a big menu for the physician office, to which your patient comes to get medical services. Thank you.
This is a CMS 1500 form that needs to be filled out after every patient visit in order to do a claim for the insurance. Here's a mind map of the differences between ICD-9 and ICD-10. ICD-9 has 3 to 5 characters and ICD-10 has 3 to 7 characters. Also, ICD-9 has approximately 30,000 codes and ICD-10 has approximately 68,000 codes. Thank you for watching this video and I hope you like it, and also I hope you learned something from it.